everyone, I'm Leah, co-founder and CEO of Providentia Technologies. Our entire mission at Providentia is to accelerate drug development while creating safer drugs for people. So I want to talk to you about what happens when drug toxicity isn't properly identified. In this case, this drug was on the market for 5 years, but it had to be withdrawn because it increased the risk of cardiovascular events and strokes. Now, for the company that made this drug, they'd already invested billions of dollars in its development, and then they had to deal with a roughly $5 billion settlement as well. But beyond the capital cost, there was also real human suffering. Almost 90,000 people were injured, and 40,000 people lost their lives. This is what drug failure really looks like, and we have to do better. The good news is that we can. Currently, the drug development process is still pretty fraught. A good drug is really hard to design. On average, it takes about $2.6 billion, 12 to 15 years, and yet this process still has a 90% failure rate. A lot of this failure is due to unforeseen toxicity issues. Now, to truly address the problem, we have to attack it right where it starts, which is in the very first phase of drug development, known as discovery. This phase lasts about 5 to 7 years, and this is the first place where drugs are tested for safety. This happens by testing those drugs on live cells. But these live cell-based screens have very parallel problems to drug development overall. They're expensive, in fact, so much so that many drugs aren't even screened for toxicity until several years into the development process. These screens are inefficient, and you add to that the current standard is to be wrong 1 out of 5 times, and it's not hard to see why this process needs an upgrade. So our solution is to get rid of the live cells. Our solution is centered around the cell membrane, and that's because every cell in your body has a cell membrane, and drugs that damage the cell membrane simply aren't safe drugs. We've learned from our research that the extent of damage to the membrane that's caused by a drug is strongly correlated with and predictive of drug toxicity. So by examining the amount of membrane damage, we can predict the outcome of those live cell-based screens. What we've created is a synthetic cell membrane screening system. Synthetic just means that we make these membranes in the lab. Our membrane screening system is robust and efficient, meaning you can screen for safety at the very beginning of the drug development process. The second component of our solution is to take our unique data type that's generated by our membrane screen and combine it with machine learning approaches so we can identify the specific pieces of the molecule, the drug, that are damaging to the membrane and driving the toxicity, and then we can offer corrective modifications to avoid the unwanted toxicity. So using our membrane screen has many advantages over the live cell-based screens. In terms of speed, we can offer data at least 10 times faster. Cost, you can save 50% upfront on the cost of your testing, but more than that, you can potentially save $300 million by not continuing R&D of a toxic drug. Data. Our data is quantitative. We can tell you exactly where on the spectrum of toxicity your drug is to help inform risk assessments of a drug lead's safety and investment worthiness. Accuracy. Our data is highly reproducible, and when we tell you something is toxic, we're correct more than 9 out of 10 times. Now, when we roll out our machine learning solution as well, which we're getting ready to set live in just about a month, that means that coupling these products, you truly have a chance to create a new standard for early stage toxicity prediction, meaning that you could potentially save 30 to 50% of the time of drug development, save at least $300 million per project, while increasing successful outcomes, decreasing the need for animal testing, and reducing environmental impacts. And we're not the only people who are excited about this idea. We're launching a pilot project with Bayer Pharmaceuticals this fall, and we have an LOI with them as well. So with thousands of biotech and pharma companies worldwide, it's a massive market opportunity that's only expected to grow. We are currently in the process of raising a $2 million pre-seed round so that we can fully automate our process to take on the volume demands of pharma and biotech and continue to expand our machine learning solutions. Critically enabled to achieve these goals, we need to grow our team. We are continuing to engage with initial target customers so more people can see the value and validity of our approach for themselves. Now, as we gain traction and scale capacity, Providentia will continue to grow, and we plan to expand into the cosmeceutical and food additive market in the near future. It's very clear that our business model is quite scalable, with $150 million in revenue projected by year 5. When we fold in our machine learning solution, the value add is crystal clear. So we are the right team to bring this to market. I, myself, am a current Runway postdoc and a co-inventor of both technologies. I am being at Runway, have the opportunity to be surrounded by other amazing founders and also, importantly, seasoned business mentors that can help me bring this from vision to successful business. My co-founder and chief scientific officer, Dr. Lilia Leisla, has over a decade of experience in biomedicine and deep drug discovery knowledge. Our primary scientific advisor, Dr. Olaf Anderson, is a co-inventor of the screening technology and also one of the fundamental players in the world of membrane biophysics, which is the science that underlies everything that we do. And as I mentioned, we are fundraising. So if the idea of improving drug development while creating safer drugs for people is exciting to you, please feel free to reach out to me. And thank you so much for the time to share with you what we're building at Providentia.
Can you walk us through the TAM, please, just to really understand it?
Yes. So there are roughly 5,656 companies per year. And if we could just capture 5 projects with them, it's $7,500 a compound. Then it's 7,500 compounds a project. Then that leads us to the 212, roughly, million compounds we could test per year. We decided on a price point of $150 for our product because when we talked to the drug makers and also when we talked to other screening companies and said, you know, what is it? What is really not encouraging people to move this process to the very beginning? And what price point would be required to do this? This is right around that number. It still, on our end, allows for a high profit margin. So if we put all those numbers together...
What's the total cost then for each project? For a single project, well, if they're doing 7,500 compounds, what's the total cost for the project? You said you save 50%?
Right, so 7,500 compounds, that brings you to a little bit over $1 million, $1.125 million.
Okay.
So are you competing with cell-based toxicity screening or animal-based toxicity screening?
Absolutely. So at this moment, we're competing with other cell-based toxicity screening. In order to know that this works, we've done a large-scale validation study where we put our assay against several cell tests that have been done in liver, lung, and neuronal cell lines, and that's how we validated this approach. So at the moment, we're in that discovery phase at the very beginning of development where you'd be screening in live cells.
Super. Thank you.
Thank you.